FM, The Source.
All right, 9 minutes before 10 o'clock. Thank you for tuning in. When you hear what our next guest does, I don't know about you, but I'm going to feel a little inadequate. I don't quite contribute. You know, we come on the radio, everybody knows our name, and yet, you know, we do a radio show. So hopefully we can give a little shout out to somebody who is making a huge difference in the lives of children. Dr. Jonathan Chen is a heart surgeon. He performed baby Sadie's pediatric heart valve surgery, and he's the division chief for pediatric cardiothoracic surgery and the co-director of the Seattle Children's Hospital Heart Center. I know he's doing these radio interviews all morning long, so I just want to make sure we get the correct information out. It's super serious, and we have a tendency to be silly, Robin and I, so I want to make sure we are refraining from that for about 10 minutes. The world's smallest and only mechanical heart valve designed for newborns is what we're talking about. That is just a miracle to me. Dr. Jonathan Chen, good morning, sir.
Hi, good morning.
What an honor to have you on our show.
Oh, it's a pleasure.
Where are you right now?
We're in Seattle. It's
okay.
4/7 in Seattle.
It's very early. Thank you for getting up early. And the bigger thank you for what you do. Is the new device that we're talking about used a lot, or is it very rare?
I wouldn't say it's used a lot or that it's very rare, sort of somewhere in between. I think part of it, to be honest, is we don't really know its broadest application yet because it was so difficult to obtain before. It existed, but it used to be on protocol, and so you'd have to actually get it in the operating room. You'd have to go through an IRB, and it takes several days. You get it from the company. But now with the FDA approval, it means we can have it off the shelf. So I think we were reluctant to use it sometimes before because of those limitations. So I think it may have much broader applications than we had.
I'm going to make an assumption, and I'm guessing every one of your radio guys is doing the same thing. Does this have to be changed a lot in the course of the life of the child as the heart grows?
Well, you know, the kind of platonic ideal of this operation, the kids should outgrow it. And most kids will look at least 2 more operations, depending on how big they're going to be.
Oh, really?
Yeah, but it's not 5-10 operations. It's remarkable how the heart will adapt as you grow, and how I think I'm always surprised at how much of a jump we can make in terms of putting in the next size. You often can skip a size or 2 when the kids get big enough.
That is pretty interesting.
And how long does that surgery take then when you're replacing it, the larger?
Probably 3-4 hours, tops.
And how long is the recovery time for the patient?
Probably about a month. About a week in the hospital. Actually, Leor could probably talk about it because Sadie already had her valve upsized, and that was a pretty brief hospitalization, I think, right?
Yeah, we were only in the hospital for about a week, not even. Yeah.
Oh, really?
Sadie is your child?
Yes, it's my daughter.
Oh, wow, didn't know you were on the phone. So are the conditions that determine that you need to do this obvious? And that maybe is a dumb question, but what would be the signs that you need to put the valve in?
The signs have to be pretty significant to talk about in this case a mitral valve placed in an infant. So they're not subtle. So in Sadie's case, for example, she was really not gaining weight. A lot of the kids are very cranky because they just don't have enough cardiac output. Yeah. And so she was actually in our ICU for almost the entirety of the time she was waiting for this. So it's not it would be rare to operate on an infant who is, say, at home, because usually those kind of kids, they can kind of eke through without needing the operation.
And can this be discovered prior to the birth while the baby is still in the womb?
Absolutely. Yeah. So fetal diagnosis, I'd say probably about 80% of the kids we see now, we will have known their diagnosis from their fetal ultrasound.
Really?
The earliest they can pick it up is about 20 weeks. And actually, the best images you get from the fetal echocardiography of the heart are at 20 weeks. And then we'll follow kids throughout the pregnancy just to make sure that everything is sort of growing and maturing as we think.
I see. So is surgery ever done before birth?
Not so much surgery. There are some interventions that are done. It's pretty rare, but that is the kind of final frontier, is can we change the direction of heart development by intervening sooner?
And Lee, when Sadie was born, how did the doctors tell you that she had a problem?
Well, like Dr. Chen said, we knew at 20 weeks that she had this defect, but it wasn't until about 2 to 3 months old that we realized she was having serious issues gaining weight. She was fussy, she was sweating all the time, she was not sleeping very well, all the signs that you would think of just a fussy baby, but just a lot more magnified.
Oh my gosh, if I were you, I would adopt Dr. Chen. I would say you can... Right? I mean,
Yeah.
oh my gosh. Are you guys close? Did you become close after this?
Yeah, actually, we see each other fairly frequently.
So would this have been, I hate to say this, would this have been a death sentence 10 years ago?
I think all indications would have needed either a heart transplant or
Wow.
or palliative care if the Abbott valve wasn't available.
Wow.
Does a Sadie have to wear a heart monitor that monitors not just the heart but the valve itself?
One of the side effects of her surgery is that she needed a pacemaker as well. So she has a pacemaker that she has implanted inside of her, and we get readings off of that all the time. But we have regular meetings with her cardiologist, and every 6 months we get another echo, and so she's very well followed.
Mechanical heart valves on kids do not require extra monitoring just for that.
And Lily, Sadie's living a normal life. I mean, she's walking and things like that.
Yeah, she loves to go to the playground. One of her favorite things to do is climb, and
Me too.
scare her dad to death of climbing. She does have to take blood thinners regularly. Anybody who has a mechanical heart valve does have to take blood thinners. So
Really?
we helicopter parents. We're there to catch her anytime But she does all the normal things that a 3-year-old does. Goes to the playground, goes to the zoo.
Wow. So if I could see the valve itself, how big is it? The size of a dime? It's got to be tiny.
So
I'm sorry?
it's about the right size, about the size of the dime.
Oh my
Size of a
gosh, about the size of a dime.
Okay, I want to make sure that any listeners who are parents or doctors even can find out more about what this is about. Can you give us a website?
Yeah, I think Abbott.com is probably the best website to go to. It has the most comprehensive information, and I think parents, also the other thing too, for parents who do have kids with heart defects, there are lots of good parental support group websites if you search for those, and they will have some information on this as well.
We have mendedhearts.org.
Is that right?
Yeah, little hearts. Yep.
Okay, that's good. Dr. Jonathan Chen and Lee, right?
Yes.
Lee, thank you. Thank you guys for both being on the show with us today, and good luck, and thank you so much for what you're doing and for sharing the information.
Welcome. Thanks for having us.
You're welcome. We'll be right back. This is WOCA Ocala.
Fox News Radio, I'm Chris Foster. Facebook boss Mark Zuckerberg is apologizing, calling it a breach of trust that a data company had users' information without their knowledge.
Zuckerberg telling CNN,
we have a basic responsibility to protect people's data. And if we can't do that, then we don't deserve to have the opportunity to serve people.
Today, Facebook executives will meet privately with